Lakshmi Garu. So thank you for taking your time off coming to this detailed Q&A session for a lot of inquiries of parents Q&A. So there are a lot of questions which parents are asking regarding their children, multiple questions on multiple topics. So we are glad that we have you here to detailedly explain every question so that the parents will get a great idea.
Oh, and it's completely my pleasure. And also there is a selfish reason might be because many parents had to understand these things much earlier before they even meet a professional, rather than directly coming to the professional. And then if we say so many things at one sitting on one day, for them it is overwhelming information. They might not even accept the problem. And if in case we talk about treatment, then it's too much for them. So if they get all their queries correct earlier and then they come to us, it's much more easier for us.
True. But I'm glad that I'm sitting with you and talking. Same here. So here is our first question, which was on top of the online questions. So my child is 2 years old and doctors tested his ears and told me that he has hearing loss and he needs to wear hearing aids or can undergo cochlear implant, which are to be continued throughout his life. So is this true, and is it safe to accept surgery for a 2-year-old child? Please clarify.
Yeah, Praharshita Garu, I think this is the very important question which I need to answer much earlier. As they have asked, there is a lot of information in that. The child at 2 years, he or she was diagnosed with hearing loss. They suggested hearing aid and cochlear implant as well. So first of all, they would not understand what is a hearing aid and why a child should use a hearing aid. Prior to that, they might even be having a lot of sad feeling that the child had undergone and a lot of tests and diagnosed as hearing loss child, and he will never be able to hear anymore. So hearing aid is an accessory. It's not a surgery that you finish it and nobody knows anything. Mm-hmm. So he needs to use that accessory lifelong. On top of it, they're talking about something like cochlear implant, that they will implant some chip in his ear so that he can hear. So all these things is too much for a parent to take. I think that's the main concern we need to address for. But what I would like to say as a professional is, always the treatment as early is the best. So by 2 years of age, if the auditory nerve is getting stimulated, and then all the language information, that is verbs, nouns and daily usage, articles, everything is given to the child, then the child can easily talk back also. But in case we wait for the child to get the treatment much later, like after 10 years, after 15 years, once he grows, then surgery is a little more easier. No, then we cannot expect speech from that child. So as early, if by 1 year or 2 years, if the cochlear implant surgery or hearing aid accessory is placed and then given treatment like speech therapies, then the child can hear and speak like any other normal child in the school. That's why, yes, early intervention is always better. Though it is difficult to understand, it's better.
Thank you so much for your detailed and a very clear explanation. I hope parents చాలా ఈజీగా అర్థమవుతుంది మీరు చెప్పే వే కానీ మీరు యూస్ చేసే టర్మ్స్ కానీ. సో మనకి సెకండ్ క్వశ్చన్ ఉంది, విచ్ ఇస్ మై చైల్డ్ ఇస్ హియరింగ్ ప్రాపర్లీ బట్ అనేబుల్ టు స్పీక్. కెన్ ఐ వెయిట్ till 5 years and then approach speech therapy, or will it be too late?
Actually, only speech and language development starts from the day 1 of the childbirth. Even during pregnancy, child starts hearing the sounds around. But day 1 nunchi, a sound vinatamto patu, they'll start understanding, okay, this is the person speaking from the lips. Some sounds are coming continuously, like amma is the sound which I've been hearing regularly. And oh, papa, palu or milk is the sound I'm hearing regularly. So this, for years together, will help them speak better. So that's why they achieve the first word by 1 year. By birthday, they'll be saying tata, mama and all that, no? So imagine if we keep waiting for it for 2nd year, 3rd year, 4th year. By 5th year, their maturation level starts little more, and that pressure will help the child to speak much better, or the first word will come at 5 years. But then what happens, this golden period of 4 years development will be behind. So the brain neuron cells will be limited. If at all the child starts speaking, by that first year itself, they will have millions of neuron cells to start developing them and encouraging the neuron cells to grow furthermore and be like any other normal. Imagine all these million neuron cells started developing at 5 years of the child's age. Then when will the rest of the neuron cells will develop, and when will he cope up with his siblings or the peer group? So to cut down all these delay of speech and language growth of the child, make it fast. Better see to that the child seeks this, gets the speech therapy intervention, and make sure that he can speak according to the age. By 1 year 1 word, 2 years 2 words, 3 year 3 words. By 4th, 5th year he can say sentences, and he can say by 5 years like, Amma, I don't want that, but I need this. Once he gets that, yeah, it's much more easier than imagine a 5-year-old is saying, Amma. We are not satisfied, huh? So, early treatment, early intervention.
Okay, so ఇప్పుడు లక్ష్మి గారు మీరు చెప్పిన ప్రకారం if a child gets a treatment at 5 years also, he might get the results. But not అంత satisfied of 2 years better results అంటారా, లేదా అసలు results రాము 5 yearsకి చేస్తే అంటారా?
No, 5 years we also we can get the results, but then out of hard work, and it will take a whole long time. When we treat them at early stages, like 2 years no treatment starts, so within 6 months we see results. 5 years no starts, so 1.5 years result time but us to get a minimum word.
Okay.
And 1.5 years he'll become 6.5. And then by 6.5 I get 1 word.
Yeah.
Then to make it 2 words, another 1 year. So it prolongs. But 2 years if we can start, it's pretty fast. Because brain is still firing fast.
Okay. So మనం third question చూద్దాం. So our third question is, my son is 13 years and he lost hearing in 1 year over a period of time. His loss is 90% and doctors say it is irreversible. Now he is managing with 1 ear but with difficulty. Does he need any treatment or this can be continued for life?
Yeah, it is so sad, Prashita Garu, because there are days they will be sleeping with both the ears hearing so well, and next day by the time they get up, 1 ear is gone. They cannot hear at all. And it is a shock for the person as such, and for the surrounding people why it happened. And even for the doctors, it is very difficult question to answer, because we don't have an answer. It's like there is no cause for that sudden hearing loss. It is called sudden hearing loss. But then the treatment is, yes, available. These people, whether it's a child or adult, they are called postlingual. They're already speaking people, and they lost one side hearing. There is another hearing, another ear is working so that he can hear and answer the questions. But there are few features which are completely missing because only one ear is active now for this particular person. Though our eyes look similar and both the eyes function is to look at people, imagine you close one eye and you're trying to look at half of the information of your vision is gone. The same way, though we have both ears and both ears are functioning as hearing part only, one ear is completely shut down, brain is getting only half of the information of the present working ear. So what is that half of the information here is either localization, suddenly sounds coming from here will be fainted, so he will not be able to check where the sound is coming from. And most of the time, all the words which we are using, especially like Lakshmi, I am, the frequencies are very different. La is different, ka, sha, ma, a, ma, everything is different. So that's why we need 2 years to catch up all these frequencies. If he's dependent only on 1 ear, half of the frequencies will be missing and only half will be heard for him. So rest of the word he needs to guess. So half of the brain will be occupied for him to guess the words or pay lot of attention. So this guessing and paying lot of attention will kill the other ear also after a certain period. So without depending on one ear throughout the life, he better get support for the other ear which he has lost, so that both ears start acting again and the brain is also happily giving information through both the ears.
Yeah. Okay, Lakshmi garu. Now the fourth question. We are planning for a cochlear implant surgery for a 3-year-old child. Once she starts hearing, will she able to speak?
I like this question, but it's a little tricky question, Andy. Because after cochlear implant, the child will be able to speak, and she's hardly 2 years old, so it will be for sure the child can speak because the child will be starting to hear through cochlear implant. But the point here is she also needs to undergo speech therapy. Otherwise, it's very difficult. So the cochlear implant will help the child keep on hearing the sound. But it is up to us to tell her that this is the language, that it could be Telugu, Hindi, Oriya. And you need to express back through this language. That is the training which is necessary for any cochlear implant child to undergo so that they can speak back. Otherwise, once the surgery is done, we feel that, now she's hearing, so she will be talking back, then that is not possible immediately. Likewise, the child will be born with a good hearing, but the child takes 1 year to speak, right? So the same way, once a cochlear implant is done, the child will take almost 6 months to 1 year to start back, talking to them back again. So this won't happen to us also. There are a lot of examples. The moment the child comes out of the theater with the pack of cochlear implant, they keep making sounds. Are you hearing? And they speak a lot. Come on, speak back. It's not that easy. Imagine, I'm talking to you in a very different language which you don't know. Can you talk back? No, you'll be watching. You'll be observing. That's what happens to this child. They need to understand the language to talk back. They can't imitate. Say Amma, I'm also saying Amma. Say Papa, you're also saying Papa. That's not possible. It takes time.
Okay, so the next question is a very informative and challenging question. So how do we know that my child cochlear implant will be successful? So what are the points we need to check before considering it?
Yeah, of course, as you said, it is challenging. There is a lot behind this question. They might be confused that whom to go. Should we go out of country or at least out of state to select the best doctor, and who first started cochlear implant surgery and who did not have any failure, we'll select that doctor and go there. I don't think that is the right way to select the doctor and the setup to undergo a cochlear implant surgery for a child. You always need to see if the doctor is easily available to talk to them and answer their queries. And the doctor is really having that concern of child's hearing. And with the doctor, it is very important to have a rehabilitator. Like speech therapy setup has to be there. And cochlear implant is a surgery where you have an external set on the ear. The implant will be going into the ear. They cut and keep the chip inside. But externally you have a microphone on processor, headpiece, so that the child is getting information from outside. So we need an audiologist to see if this accessory is working well. Anything wrong in this accessory, it has to be corrected immediately so that the child starts hearing again. And you need a speech therapist who can tell what you're talking. You're talking a verb, you're saying some phonemes. So can I consider these phonemes and make it a word? Yeah, you said a word, high five. So unless you have this team working as a cochlear setup, there is no point you just undergo surgery and go home, the child will be speaking. No, you won't even understand if the accessory, the microphone, everything is working well or not. Other than this team, even psychologist plays a major role. Pediatrician plays a major role. Please select a place. It could be a corporate hospital or a dedicated ENT center where they have all these team people. A surgeon, pediatrician, psychologist, audiologist and speech therapist. then yes, they can go ahead and confidently undergo cochlear implant surgery.
Thank you, Lakshmi Garu, for your detailed, valuable answer for one of the very important questions. So, my next question. My child doesn't speak and doesn't show any other problems. Very quiet kid, but he hears every sound and turns to it. Is this normal or should we consult?
I'm actually sorry for this kid. This is a huge concern because as speech therapists or as professionals, we are always happy if the child cries. Even in a pediatric consultation setup, the child will be crying before even seeing the doctor, assuming that, yeah, he's a doctor, he might give medicine or injection. So that means the child is proactive to understand things what are happening around. So imagine the child is not crying even looking at the doctor, looking at the syringe. Then it's a concern. He didn't understand what is happening around him. So in case the child is playing to himself, that's called self-play, and he is just roaming around in the house into the corners, that means half of his sensory input is not working. So he is not enjoying what is happening around, and once he doesn't enjoy what is happening around, he will not be willing to say back. Who is there to talk back, or who is there to express back? So he is self-talking or self-playing, or he is in his own trance level. So that means brain is shrinking. It is not developing. So make sure the child is seen to a professional, and make sure that if at all the age and the skills development is not matching, he is 2 years but he is hardly saying one word, or he's not at all saying any words, then it's a bigger concern, and start intervention as early as possible to match his chronological age and his mental age. Active child always cries, and make sure things are okay around. If they're not crying and not showing any response, then it's a bad sign, so they need to undergo intervention.
Okay, so the next question we have is a very common thing in every household, which every parent faces. We understand that screen time is not good for children, but my child eats only when the screen is shown. I do not understand any reason why she doesn't like eating and how to make her eat otherwise.
Yeah, as a mother and also a speech language pathologist and a professional, I understand the concern. Every mother wants their child to eat well and sleep well, and they feel that is the priority and first concern. So anything goes wrong with these things, like they're not sleeping well on time, or they're not eating, or they're not going to potty also so well, that's a bigger concern. But we need to understand, because now the speech therapist is talking, we need to understand that every day the child will not be eating well. Okay? And all the meals, the breakfast, lunch and dinner, or the in-between meals cannot be completely full meal. And at the same time, because there's a difference in child diet, right? We don't give all the masalas to the children. So just because we need to give bland diet to the child doesn't mean that we give routine dal and routine nuts and same juice every day so that he builds up a lot of proteins and he'll become like a Horlicks boy or Johnson boy. It doesn't work that way. They need different tastes to explore so that the taste buds are ready for any kind of taste. And they need different textures of food so that they're ready to chew even the harder ones. And they need different timings sometimes. Sometimes you can skip a complete dinner. And you can skip a lunch and give only liquid. It's okay, you can leave, their tummy will be happy. And what kind of work do? They hardly sit in one place or move around. So it won't digest for few days, and then again they are fit to digest again. So unless you understand this flexibility and feed them, feeding is always difficult. And many mothers, without understanding this flexibility, just to feed them forcefully, they start using gadget. So gadget only becomes a diverting factor. But gadget and food has no connection at all, ma'am. So it's just the habit the mother must have made it. So without gadget, keep giving gaps and make sure that they're hungry, and then you give them anything which they consumed earlier, they'll happily eat without gadget. So you can skip gadget, not necessary at all.
Okay, Lakshmi Garu, that's a very important thing all the parents should understand. No, parents are everyone, be it a sibling or anyone. It's a servant net tab or phone in those kind of scenarios. So they have to give. Okay, so the next question is, what is the difference between the therapies they are mentioning like OT, BT, ST? So, Marco, what are the...
Yeah, actually, as a professional, I should say sorry for creating these kind of confusions to the other people or the patients. Earlier, as speech therapist, see, I've done my speech therapy course in 2004. So, when the studies were just coming up on speech therapy and TNT, audiology and TNT, when these studies were coming up, we studied as a holistic approach. So, once the child is in your clinic, you should understand whether they're walking properly, they're sitting properly, or they're looking at you, giving an eye contact, attention span is there or not. Are they able to give a shake hand, like touching your hand or not? So we always saw them as holistically. But nowadays, as specialists have grown up, so now it's 2024 and specialists coming up saying that I am specialized in touching or giving an eye contact and hearing. I'll make sure the child will sit. Another person comes and says, I'll make sure that the child will not be behaving bad. He will listen to you. And then the speech therapist comes and says that, oh, I will only teach speech words. I will not touch him or touch his behavior problems. That's when it became occupational therapist, a specialist who says, I will make sure his senses are working properly. A behavioral therapist who says, I'll make sure he'll sit. Then the speech therapist aram se will come and sit and say, now you talk, I'm ready to teach you how to talk. All these works we used to do as a speech therapist, as a single person, because we always saw the child as a holistic person. So before even speech therapy, they better sit properly. To make them sit properly, they need to be stable in their senses to see you and understand you are a new person, stranger, I better listen to her. So unless I go par with those lines, I'm not a speech therapist first of all. So though we used to do it as a holistic, now they're making it parts and bits and pieces. And now that's because of that the parents are confused. What is that they need? Unfortunately, they need everything. But only thing is because of the severity, if the child is having everything fine, but except that he's frozen, he doesn't want anybody to touch him, then only the specialist enters and helps the professional that, okay, try to do this, maybe he'll be okay. But otherwise, they need a holistic approach. Don't get confused. A speech therapist can do everything unless they're very severe problems. Then automatically speech therapist will seek a professional help and they will clarify that.
Okay, Lakshmi, so now we understood what's OT, BT and ST. So next question is, can we expect speech from a child with cerebral palsy? Also, what kind of treatments are available for that?
Cerebral palsy is little different, Andy. Unlike the other problems which we have been discussing, the brain is not working for them. Like neuron cells are there and brain is active at least when they are born. But cerebral palsy, most of the time, the brain functioning itself is compromised. So half of the areas have been already shrinked. They'll not be able to move their hands or they're clasped. They're frozen. They can't do certain activities. They will only be like a frozen person on the bed. They need help all the time. So for them to speak, it is very difficult because brain cells are already shrinked a lot. But they can get compensatory speech. Like they'll be dragging the speech. So that kind of a speech can be achieved by a cerebral palsy child. But yes, as they rightly asked, they need a lot of interventions to at least achieve that kind of speech. Muscles have to be treated. Oral structures inside have to be treated. They have to give a lot of information for years together to achieve even that one word. And not only professionals, teamwork of even parents, continuous effort only can help them achieve the speech. Otherwise, see, for any parent, after a while, they give up. Patience will be lost for them, because nothing is coming out of lot of effort what they are giving. So if at all we give up because at a certain point, then we might not achieve speech. But in my experience, I've seen a lot of parents who show a lot of patience and they were with the child for 10 to 12 years and then they achieved speech. And here I would like to quote one of my example in Europe. I have seen that the child was almost 16 years. Europeans are like huge. The mother was literally holding the child, though the child was bigger than the mother's height, and she brought them to the clinic. I was like, even at that age, she's expecting the child could be better. Then I asked her, like, oh, you're brave and you're dedicated. I'm happy you're giving this information, this interventions to the child. Then she said one thing, I will be no more in few years. I hope he will at least achieve something before I leave. So this is the hope many parents have to make sure the child speaks and gets some betterment.
Okay, so that's a very brave mother, and I think every mother should have the determination in while a child's story. So the next question, do we have medicines to make children speak?
Yeah, that's an interesting question. Really, many people ask this question to me because there's a genuine doubt also, because many doctors try to give some tonics to say that, give this and he'll get matured and he might talk. That's a kind of, placebo. Placebo, you understand. Psychologically telling that, your pain is gone. But it doesn't happen that way. As you all can understand, I give you a tonic and you understand Telugu. A language as such. How do we talk? We see the media as a language. I want to express something. The media is some language which you and me can understand together. So tonics cannot imbibe the language or the words into your brain. Ultimately, whatever we speak, that has to be understood by the child and that has to be expressed and imitated back. That's how we achieve speech. But these tonics might help like vitamins, which can add up few more neuron cells or add up little more fire in the brain and make the child little active to listen to you. But most of the times it doesn't act continuously. It's an episodic thing. And already if the child is having certain amount of neurons in the brain, then it is an adding factor. Like I can give you another analogy to make it clear is Horlicks and milk. They say you take Horlicks in the milk and then you are better as a person. Your child will develop, height will grow and all those things. Is the important ingredient is Horlicks or the milk? Horlicks is only a flavor with certain but ingredient is milk. So we always get the advertisement of Horlicks but never the milk. So if you understand as eat the Horlicks and then you grow better, it's not going to happen. Just to kill that milk, you're adding Horlicks. The same way, you need lot of speech therapy interventions and lot of stimulation for the child. Give attention to the child. Make sure the child understands you and give back. Then the added could be these vitamins and medicines. But to get speech, I'm sorry, no medicines. Sorry to disappoint.
Lakshmi garu, meer maatladaka, I thought it was a very simple question, but after you gave information, I thought it's a very important question that every parent should know. Like, there's no medicine for people or for children to talk. Next question, child with ASD, whom to be blamed? Parents, child or science?
Actually, please don't blame anybody for anything. It happens.
Sure.
Yeah. Child with ASD anesarki, out of my experience of 15 to 16 years, what we observed is they are born normal. Their scores are very good. Their development of visual, hearing and their movements. Milestones, what we say is their neck control. They're sitting on time, crawling on time, and they started walking by 1 year. So once the child achieves all these motor milestones on time, speech development is a follower. It comes also on time. But generally what happens is that once the child reaches this 1 year age, they will start doing little more exploring things. Ziddy, cunning, being naughty and things like that. So then to control that, many parents tend to seek some easy methods, like by controlling him by putting an IMR next to him, or putting him in front of the TV and leaving him, or giving a gadget so that he doesn't disturb or spoil anything around and he will be happy in his own world. Sometimes I even heard parents saying that let him learn ABCDs and rhymes faster. So that's why I'm giving this, so that once he learns all these things, school appointments are much easier, or admissions are much more easier. So because of these things, what is happening is the child is losing connection to the humans or to the environment. Though he's learning ABCDs and colors much earlier, by 1.5 years only, how does he communicate about those words to the opposite person is what is missing. The child will be speaking, hearing, they know the language, but communication is the main part for ASD. If they are not communicating with the parents or by surrounding people, they will not be able to get even admissions in the schools, and the relatives or anybody would say something wrong with your child, he's little different. That is what is coming up as ASD. So now tell me, whom to blame actually? You can't blame anybody, but make sure that his development is very good even after 1 year. The typical child being naughty, please be patient and make sure the child grows well.
Okay, Lakshmi garu. So next question is about hearing aid and So hearing aid gives radiation to the ear and headache. So it is not good to wear them for more hours. So Adi, is this true?
Actually, no, not at all. Maybe చాలా మంది ఫోన్లు వాడేసి and thinking too much about green and environment and all that, they might be having these kind of questions. But hearing aid is a simple gadget where it has microphone, it tries to amplify the sound and it gives that sound to the receiver. తీసుకో అని చెప్పి. So అంతే. It is not going to connect with any kind of sunlight or Airtel signals, phone signals, radiations, satellite. No, there is nothing of that sort which is embedded in the hearing aid. So definitely hearing aid is much safer. Don't think too much about radiation or anything. Like for example, you are using earphone. Your phone is somewhere, your earphones are something else. So your earphones will not give you radiation kind of a thing unless it catches as a Bluetooth signal and then too many hours you're keeping in the ears. Then it might show some effect. But as such, a hearing aid job is to pick up the sound, amplify it and give it to your ear for at least minimum 6 to 8 hours a day. That is a very good time. The rest of the time when you're sleeping, when you're taking bath, washing your face, like spectacles, we don't use a hearing aid. So using a hearing aid in a daily basis for long hours is very important, and it is necessary for your auditory nerve and brain to be more active to listen to the sounds which are coming around. Antekani radiation coming and attacking into the ear and connecting it to the brain is a myth. Please don't believe in all those things.
Okay, Lakshmi garu. So here there are a number of questions of hearing aids gurinchi anamata. So here the other one is, hearing aid to 1 year is good enough. Using it for 2 years is not necessary and gives too much sound. So is this true?
If a person is having hearing loss in both the ears, then hearing aid is necessary for both the ears. That's a simple logic. So you have hearing loss in both the ears, and we are treating only 1 ear and still there is loss in the other ear. It is something like we are doing a surgery, taking a half tumor and leaving another tumor inside for the next surgery. Will anybody do that, or any patient will accept such thing? Nobody likes it that way. But everybody needs a full treatment, right? So when you have hearing loss in both the ears, we better get treated also for both the ears. So that will ultimately help the auditory nerve to gain help from both the ears, so the sound is gone easily into the head. With 1 ear, it will be going with little more difficult, and half of the information will be going there. So rest of the ear will be under rest, and later, even if you want to give an amplifier, that is hearing aid, it is going to say that no, from ages I'm sleeping, I don't want to get activated now. So even if I give a hearing aid, it will not be active. So we always have to lifelong depend on one ear with the amplifier. Imagine when they become old, they lost hearing loss further, profound hearing loss, 100 decibels, 120 decibels. Then this hearing aid will not be able to help them anymore. So even the other ear is lost and the hearing ear is also lost. Then they'll become deaf completely, no hearing at all. So when you're getting treated, it is always better to get treated completely and with good amplification. So there's another query in the same question saying that too much of sound once you give 2 hearing aids. No, nowadays these digital hearing aids are equipped in such a way that we'll give only necessary sound. We are ready to cut down the noise. Then why the hearing aid will be giving noise? So it is definitely a smooth sound from both the ears and well programmed. No need too much volume at all.
Question on the same topic. Can I use my hearing aid only when I go out or only when it is necessary?
Actually, it's not a jewelry that, we have to show our best when we go out. And we can be very casually sitting at home. No, auditory nerve or your brain doesn't work that way. Only if you can activate it in all kinds of situations. For example, you're just sitting in the house, TV, and you're the only person at home. So you don't want to listen to anybody. Even then, try to use your hearing aid so that you will understand or hear immediately if anybody is knocking the door or calling bell was there or any cat or anything broke in the ear in the house. So to be attentive all the time to listen to what is happening in the surrounding area, even at home, please, we need to use the hearing aids. So in case, imagine that nobody will come to my home, no cats will be there, nothing will be broken. I don't want this extra sound, so I want to listen to only TV. And suddenly when you go out, you want to listen to your friend, then you want to listen to your surrounding sounds, and the friend is talking very fast. You need to catch up with the speed of the speech of the opposite person. Your auditory nerve doesn't act suddenly. Unless we continuously make sure it is active, your auditory nerve will say, till now I'm sleeping, I'll sleep now also. Just because it is important situation for you, that doesn't mean I get up and start hearing and give valid information to you. Brain will also not receive the valid information. They will be struggling if they keep the hearing aid suddenly. That is when many people complain that whenever I keep the hearing aid, it is noisy. Because till then their world is so silent. Suddenly they keep the hearing aid and they go to the party, which is the most noisy place. Then they'll say, no, till now my world is so silent, now it is so noisy because of the hearing aid. It is not because of the hearing aid, because you came to a party. It is a place where there is noise. If you would have used your hearing aid in all kinds of situations, you could have got used to it and been adjusted according to it. And hearing aid is also happy and ready to adjust according to the situations. So always use the hearing aid, not according to the situations.
Okay, so hearing aid on so continuous ga pettukovalannappudu won't there be any discomfort ear ki ala. So ఇప్పుడు earphones plug in చేసుకుంటే we'll have a lot of discomfort. ఒక 1 hour తర్వాత నొప్పి వస్తుంది చెవులు. So is it the same for hearing aid?
లేదండి, జనరల్గా కస్టమైజ్డ్ హియరింగ్ ఎయిడ్.
Okay.
Hearing aid is like a cashew nut which goes back of your pinna. Okay? And there's one small thin air, and that receiver is adjusted in such a way that we take the impression of the person's ear and the same size mold will be kept inside.
Okay.
So because it's the same size of the mold which is going inside, it is a fixed one it's like originally their own anatomy ear.
Okay.
So they will not be finding it in difficulty to handle or anything. Otherwise also, it's like spectacles.
Okay.
I know even people who wants to sleep with the spectacle because that will become their anatomy. It will become a body part for them. So here, make sure that you adjust your hearing aid like your own body part. Don't take it as a separate part. Like there are some people, they need watch all the time. They can't talk without watch. They got adjusted. They sleep with the watch on. So unless you imbibe that, it is very difficult. And if at all it's a proper mold fit inside, it's not any discomfort or anything.
So next question, is there any difference in hearing aids from different country and Indian hearing aids? Can we purchase them from abroad and use them in India?
Yes, actually hearing aids are different from abroad and India. But at the same time, that doesn't mean India manufactures hearing aids. We just recently started manufacturing hearing aids, but not the up to mark of abroad hearing aids. We do get hearing aids from abroad, but they are designed in such a way that they can the end user can use it in Indian scenarios. But at the same time, the international market has made or designed the hearing aids for India market and for the international standard market according to the environment, climate, weather and conditions like that. But buying hearing aid from abroad is something like it's a disposable thing. It can fit, it might not fit to your exact problem. So unless a dealer or an audiologist is sitting with you and trying to guide you on what kind of hearing aid is actually necessary for your problem, otherwise you're in a trouble. You might either get overgained hearing aid, that much gain is not necessary for you, or undergain. Though you're using the hearing aid, you're not able to hear properly. So getting a hearing aid from abroad just by telling that I'm not hearing will not help you because of these issues. And the softwares which are designed are different from abroad and in India. In India, we can only adjust the sound volumes and frequencies with the Indian software. If you give the same company hearing aid which you bought from abroad, the software and the license or the serial number will not match to the software which you are using here from the hearing aid and the software. So we will not be able to adjust and program according to your problem and then satisfy you with good hearing. So that is the problem you might face in case you buy hearing aid from abroad. So buy it with a proper dealer or an audiologist who already have the foreign hearing aids with them, which will work very well according to the Indian scenario. That is the best way to choose hearing aids.
Thank you so much, Lakshmi garu. It was a really valuable Q&A session, like the way you explained the examples you gave me, the true examples. I hope parents or queries 50% or more than 50% వాళ్ళకి already clarity వచ్చి ఉంటే definitely video or a session చూస్తే. So thank you so much for making it easy to understand to few of the complex topics or few of the very silly topics which most of the people are not aware of.
No, I'll be more happy if you could understand this simple language and it's very relevant to the question, whatever I could answer, and that is helpful for the person who asked. Then I'm more happy to answer these questions. And thank you for your time also, for collecting the questions from the other person and seeking an answer from the professional, and you are the best media I could find to give a good time and conversation and make sure that the professional answers are reaching the people who are really necessary. And thank you for your patience.
Thank you.